Alright, so today we're going to do the abdominal test. So first we're going to start with just a quick inspection. So I'm just going to be my patient supine with her neck flexed, hips flexed, knees bent. Just going to use pen light and look at tangential lighting across the abdominal area. I'm looking for any scars or bruising or anything like that, and then also any palpations or any different things that would indicate a possible issue with any of her vessels in the stomach or with her colon or anything like that. Everything looks normal there. So from there, we are going to start to auscultate. So first I'm going to listen for bowel sounds. So you're just going to feel the diaphragm of the stethoscope, and I'm going to go from in the four quadrants, starting in I'm going to start in the lower right, and I'll go around to the 4. Then after that, I will listen or auscultate for any bruits. So for there, you're listening for about 5 to 20 seconds, and you'd expect to hear noises. And if you didn't hear noises, you would listen for up to 2 minutes to confirm that there were no noises. So now I'm going to auscultate for her vessels. So I'm going to start with the abdominal aorta. Then I will go to the renal artery, iliac artery, and femoral artery. And I'll use the bell for this. So I'll start with the renal, or at the aortic. Go laterally to the renal, inferiorly to the iliac, and then if you could just slide your hand down just a little bit, awesome. Listen to the femoral. Awesome. So you can put that away from now. So then for now, we're going to do the same thing, but we're going to auscultate for any rubbing or any friction differences on the spleen and on the liver. And this is done with the diaphragm. Everything sounds normal there. So then now we will percuss up and down the abdomen in 3 different planes. So I'm going to go up the mid-sternal line, then up the mid-clavicular, then up the mid-axillary. I'm just palpating to make sure that everything sounds normal here. So you're just going to feel my hands on your stomach. Mid-clavicular. Mid-axillary. Good, everything sounds normal there. So from there, we're going to go to check for any splenic enlargement, and we're going to percuss for splenic and liver enlargement. So we'll start with the liver on my side. So I'm going to go down from your ribs to try to find the top side, and then I'll go up from the bottom to try to find the bottom side of that. So if you could create a tissue barrier for me on the right. Awesome. Let's break out there, and then I'll start down here. That's right about there, and that's about the normal size of your liver. So now we'll go over and we'll do the spleen. Listening for that to get dull, and that's about normal size for the spleen as well. So now we are going to percuss over the kidneys, so I'll have the patient sit up for me. And we're just going to give a light basically punch to the kidney to see if there's any pain coming from this. So I'll just feel a punch. Any pain with that?
No.
Any pain with that?
No.
Awesome. So you can lay back down. So then we'll go into the rebound test, which is just a general abdominal test, checking for any referred pain. So if you can just relax. Any pain with that? Awesome. So then we are going to go around and palpate superficially and deep in the abdomen. So if there's any pain, you would start just after that. But since she doesn't have any pain, I'm going to start in the lower right quadrant. So I'm just going to palpate around your stomach lightly and then heavier the second time. A little deeper. Is there any pain with that?
No.
Awesome. So from there, we're once again gonna, before we percuss for the liver's edge, now we're gonna try to palpate for it. So you can use one of those three methods. I'm gonna use the hook method. So if you could take a deep breath in, I'm just going to palpate under your ribs and then let it out. And from there, you can kind of feel the bottom of the liver, which feels like it's in about the right spot, which is good. And we're gonna do the same thing with the spleen and the gallbladder. So we'll start with the gallbladder. So if you could take a deep breath in. No. Any pain with that?
No.
Good. We'll do the same thing with the spleen. Deep breath in. No. Got any pain? Awesome. So now we're going to go to check the abdominal aorta. So I'm just going to palpate in the midline of her stomach, palpate a little deeper, see if we can feel a pulse there and make sure everything feels normal. So I'm just going to feel my hands here and you can relax. Good. Everything feels normal with that. There's no issues that I would suspect with that. Then we're going to get into kidney capture. So I will have patient lean up just slightly and I'll put my hand on the backside of where the kidney would be, and then I will try to essentially trap it in the middle there. So I'll push up with my bottom hand and down with the top hand. And once again on the other side, that same thing. You can lay back down. Good. Everything feels normal with those. So now we are going to do that same rebound test again, but this time you're actually testing for appendicitis. So I'll start in the lower left quadrant and do that rebound test in the pain. If there was appendicitis, we refer to the right side at the appendix. Any pain on the right?
No.
Good. So then McBurney's point is the last palpation. That's just a third of the way between the umbilicus and the ASIS. So we're just going to palpate in there, feeling for any tenderness or anything that would indicate maybe a hernia or anything like that. Any pain with that? And then last, we're going to check the psoas and the obturator. So I'll bring the patient's knee up into 90 degrees of flexion at the hip and the knee. And I'll have the patient push against my hand. Any pain with that?
No.
And you could do this on the side and pull back on the knee, but we'll do it supine. And then you would turn the leg into internal rotation for the obturator sign. Any pain with that?
No.
And we'll do the same thing with the other side. Push against my hand. Any pain?
No.
And turn it internal. Any pain?
No.
Good. And then that's the end of the abdominal exam.